1. Recently, there has been an increase in the number of individuals presenting with a specific set of symptoms. These symptoms include low back pain, accompanied by hip pain and radiating down the leg. While low back pain and sciatica are relatively common conditions, this year I have observed a higher prevalence than usual. Interestingly, through my clinical experience, I have noticed a correlation between these symptoms and gastrointestinal issues. 2. Another prevalent set of symptoms involves gastrointestinal disturbances such as frequent episodes of diarrhea, abdominal bloating, and recurring discomfort. Initially, one might mistake it for a typical stomach virus, as we often see seasonal outbreaks. However, this year, the situation is distinct. The symptoms are persistent and can last for several months. It is important to note that the issues extend beyond the stomach, affecting the entire gastrointestinal tract. It is worth mentioning that some individuals have sought medical attention at the emergency room multiple times due to these gastrointestinal symptoms, despite normal findings on diagnostic tests. 3. This year, there has been a significant increase in the number of individuals experiencing tinnitus, and what's surprising is that many of them are quite young. Normally, tinnitus is more common in older individuals, but now I am seeing it in people in their 20s, 30s, and 40s. There's a considerable number of individuals under 50 experiencing tinnitus, and the numbers continue to rise. From my observations, it seems to be related to inflammation in the brain, and also related to the stomach problems. Additionally, there has been an increase in the number of people diagnosed with brain cancer this year compared to previous years. I had a patient who experienced a remarkable occurrence whereby one of her ears discharged fluid throughout the entire night after a treatment. After several subsequent treatments, her tinnitus disappeared, and her hearing actually improved. Previously, she couldn't hear people talking when they were a little far away, but now she can. One day, she overheard her teenage children talking about her, and it startled them when she responded. She jokingly said, "If I had known, I would have kept pretending I couldn't hear." Initially, both of her ears were free of tinnitus, but this week, she mentioned that it has returned. It seems to be associated with fatigue after going out of town, but I've noticed that if the inflammation in the brain is not resolved, the symptoms tend to recur. These 3 symptoms I mentioned are not just recent occurrences. They have been persisting for several months this year, affecting a significant number of people, more than ever before. Now, during the summer, I would like to offer a suggestion to boost your immune system and prepare for the coming winter. Get more sunlight. The sun is the best medicine. However, there is a specific way to sunbathe effectively. Otherwise, the results may not be good. 1. Sunbathe until you feel thoroughly warmed up inside your body. The internal increase in body temperature is essential for enhancing immunity. Merely sunbathing for 10 minutes or even 30 minutes without achieving this effect won't be beneficial. Research shows that a 1-degree increase in body temperature leads to a 5 or 6 times increase in immunity. 2. Initially, it may take a few hours of sun exposure to achieve this effect, but over time, the duration will become shorter. Choose the right time. Sunbathe during the early morning or late afternoon when the sun's intensity is lower. Avoid sunbathing during the peak hours when the sun is at its strongest, typically between 10 a.m. and 4 p.m. Sunbathe with your back facing the sun, rather than directly facing it. The back has many acupuncture points associated with internal organs. Sunbathing the back is particularly effective in treating lung-related conditions such as coughs, colds, allergies, and asthma. 5. When sunbathing, it is not necessary to remove clothing. You can still benefit from sunlight while wearing clothes, although wearing fewer layers or lighter clothing is preferable.